So my name is Aswan, and I will be your host today. I think we shouldn't. The participants are slowly coming in. I think I'll just start off with introductions. We are delighted to have Dr. Ray Yotzi and Mr. Yona Eliud Yangaza with us today to talk about the global and grassroots efforts towards SkinNTDS integrations, how we can all contribute. And Mr. Yangaza is going to talk about the role of social medias on NTDs. Dr. Yotzi, can I please have the next slide? Thank you. And so welcome. And so, like I say, my name is Aswat. I'm one of the public health trainees with a special interest in dermatology based in Australia. And we also have Dr. Luisa Paulo Silveira, who is based in Brazil, and she is a dermatology trainee. So we are from the Global Trainee Community, which is part of the trainee arm of GloDerm International Alliance for Global Health Dermatology. We promote knowledge equality by improving access to educations for dermatology trainees across the world. We aim to provide free education events and opportunities to build networks and collaborate. And next slide, please. Thank you. Just some meeting etiquette. So your audio will be muted and your camera will be turned off for the duration of this webinar. If you have any questions or comments, we encourage you to share it by the chat functions at any time, and we will share this with our speakers at the end of the webinar. We will also be sharing a Google form with you in the chat, and please answer the questions while we go along the presentations that Dr. Yotzi and Mr. Yangaza will prompt you when to answer this question. We will also be sharing some information about the GloDerm trainee community in the chat function. Next slide, please. So like I say, we're delighted to have these two speakers with us today. So Associate Professor Ray Yotzi is a dermatologist currently at the Tulane University with her interest in global health, has cultivated her expertise in skin infections. Prior to joining the faculty in Tulane, she was an assistant professor at the School of Tropical Medicine and Global Health at Nagasaki University, Japan. She received her master and PhD in international health from the Liverpool School of Tropical Medicine and the University of Tokyo, respectively. She especially has a long-standing track record of contributions to the field of skin-related neglected tropical diseases, or the SkinNTDs. She has acted as one of the pioneers in promoting SkinNTD integrations aiming at better disease control through resource and opportunity sharing. Also, she was the author of the recently published SkinNTDs framework, first documents by WHO on SkinNTDs, putting skin health to the global agenda. Her research focus has been on the epidemiology, surveillance, and management of SkinNTDs, especially recently through the use of digital health tools. She has developed an innovative digital health tool, the eSkin Health app, to bring healthcare closer to where people affected by SkinNTDs live in low and middle income countries. She also works on innovations for diagnosis and treatment of SkinNTDs. She has multiple functions in the global community, from acting as a consultant for WHO, editorships in multiple journals, and leadership roles in dermatological or NTDs related groups. Her vision is to contribute to achieving skin health for all as a part of universal health coverage. So we are very delighted to have Dr. Yotzi with us today. As Mr. Yangaza is our second speaker. He's the public health advocate, medical researcher, a visionary and charismatic leader with bachelor degree in medical laboratory science from Muhimbili University of Health and Allied Science. He is an aspiring global health scientist with particular interest in public health, specifically in fighting against NTDs. He was the first social media manager of Africa of the International Society of Neglected Tropical Diseases. He has 2 publications and participated in Tanzania Demographic Health Survey and Malaria Indicator Survey in 2021-2022. Currently, he's participating in Tanzania HIV Impact Survey 2022-2023. He has participated in more than 20 impactful projects from different organizations, including the Task Force for Global Health and the Center for About Science. So we are also very delighted to have Mr. Yangada with us today. So without further ado, we will have Dr. Yotsu to start off her presentation now.
Well, thank you, Aswan, for your introduction. And I would like to also thank the Global Training Committee for inviting me to give a talk on global and grassroots efforts towards SkinNTD integration and how we can all contribute. And hopefully, in the end, we have some time to discuss this together. So today's talk will include these things, and the Google form, we prepared a Google form for the poll, and which you will find in the chat later. Introduction to my work. Well, Aswan already went through most of the things, but I'm a dermatologist in global health, originally trained in Japan, currently in USA, and with the interest both in dermatology and global health, I was trying to come up with an area where both interests combined together. And my first interest was in leprosy. And now with the SkinNTD integration as what we are going to discuss today, currently I also work on other diseases in the SkinNTD group. I will introduce some of my projects during the talk. So recently, this year, we have, I've acted as consultant to develop this WHO strategic framework for the SkinNTDs. And so this topic is really ongoing approach that we are now doing for skin diseases. And you can find the document through this link. Diseases in the SkinNTD group. So WHO lists a total of 20 diseases or disease groups as NTDs, neglected tropical disease, and among which 9 or more diseases or disease groups have some kind of skin manifestations as shown on the slide. And these diseases share commonalities, and therefore, this is now grouped as a subgroup to work together for more efficiency, well, use of sharing of resources, and etc. So global burden of SkinNTDs, but also the skin diseases are very high, but are largely neglected. SkinNTDs are known to affect over 1 billion people who are at fixed or affected by one of the, or sometimes co-infected by the SkinNTDs. Skin diseases in general are 18th leading cause of global disease. That is the life years. It's a measurement of how the disease impacts an individual, and the 4th leading cause of disability worldwide. Also, high prevalence are seen in remote communities of low and middle income countries, including in Africa. Looking at some of the epidemiology together now, epidemiology of leprosy, and I've put the slides focus on African continent as to connect to Jona's presentation, but I know that this is some of you are connecting from other places. So globally, the epidemiology of leprosy is around 200,000 to 250,000 people. But during the COVID time, of course, the reporting was affected. So this is the data from 2021. And about 15% of these cases are known to be from African countries. And 13 countries are listed as part of the 23 priority countries worldwide among the African continent. And if you're interested in your own country's data, you can go to the WHO, this website, and find about your own country. Looking at the scabies, this is also showing the global, but the statements here for the African continent, but which are showing actually a big gap in our knowledge of the disease. As you see this skewed distribution in China and also in some of the Pacific Island countries. However, if you look at the African continent, it's actually the burden is shown as it's less than, for instance, United States or in Europe, which is, you can imagine, actually is not. So there is still a big gap in epidemiological knowledge of the SkinNTDS. And so leprosy is one of the diseases that have the reporting system in place, but other diseases, they are not. There are for some diseases, but this is not in place for many of the others. Impact of SkinNTDS on an individual is that it's a very long-term disease that requires long-term treatment and management, and that many of the diseases needs to be identified individually and given the treatment. And also many of the diseases lead to disabilities and deformities. This is showing the leprosy deformities in the center, and which will deprive one from opportunities from education, work, and social lives. And you can imagine how that can impact the individual. And many of these things are shared for all SkinNTDs. So that's why we would like to work together, and the goal of the SkinNTD framework is to reduce the mobility, disability, and social psychological impacts of SkinNTDs and other skin conditions through a people-centered integrated approach. Objectives are to adapt and implement integrated SkinNTD strategies based on local endemicity and needs, strengthen person-centered SkinNTD services and care, enhance disease surveillance for SkinNTDs and wherever possible other skin conditions, as also there are so much burden of skin diseases in general in these communities. Strengthen monitoring and evaluation of outcomes and impacts of integrated strategies. And lastly, to enhance advocacy, coordination, partnerships, and country ownership towards aligned targets. So the slide is showing the 20 key cross-cutting areas which were identified through the document development of the SkinNTD framework. I'm not going to go through all of them since there are many, but you can find these, if you're interested, you can go to the document and read about more in details. Here, I'd like to introduce these areas: social mobilization, active case detection, training and capacity building, surveillance, and data management through the projects I do in Côte d'Ivoire, a country of Western Africa. And I've been working in Côte d'Ivoire since 2014. And this is one of my first study done over there, doing skin surveys, especially in schools. And this is one survey is about 1 to 2 weeks activity. We go and screen, we went and screened about 10,000 school children. But then even if we screen these many children, the SkinNTDs, beside the scabies, because scabies is a little bit, epidemiological distribution is very high, prevalence is very high. as compared to other SkinNTDs. So this is the number that you see for SkinNTDs beside the scabies. And if you include the scabies, the number becomes high. Also, for skin diseases in general, you see that 1 in 4 child is actually affected by some kind of skin disease or diseases, which mostly are fungal infection or some types of infections. So lessons learned here are that there are benefits of SkinNTD integration, and that we also see the high prevalence of skin diseases, and looking also to these diseases increase community acceptance. Also, there was a need for system development for conditions, for development for continuous case detection and management, because many of the SkinNTDs are long-term disease. And if you go there to the field once or twice a year, it's not enough. And even you also detect a case, you cannot follow up these patients. And so there was this gap that we needed to fill in. So currently, this is how we are working in Côte d'Ivoire. This is our initial, on the left-hand side is our initial approach. And currently, the approach we are using are with the digital health tool, especially I've been developing this application with a Japanese app company, eSkinHealth, and trying to enable year-round surveillance and also to follow up these cases of SkinNTDs and other skin conditions. This is the eSkinHealth app. Just briefly, that the device is for function as a portable patient chart that the nurses or community health workers use tablets to manipulate this application, and also that to address the poor internet connectivity that we have this offline function for remote use. And this allows organization of patient clinical information and clinical images in a chronological order. And also we have this function to input the exam so that the workers at the peripheral do get these results back. This is some of the preliminary outcomes of the pilot trial. Currently, our project is funded by NIH, and this is one of the studies that I've conducted this year. And then, excuse me. And so we have many data, but also about a number of skin diseases. But here I wanted to present about the voices of these grassroots level workers, and that the benefits they are feeling from this project is that this project has been good. With the training in dermatology, now in my village, I am known as a dermatologist, and this is a nurse. And this is already a success in my job. Before our project, these nurses were not able to diagnose the skin diseases. So in their patient chart, they just put skin diseases, but now they are able to name some of the skin diseases. Also, the challenges were that the first challenge was to be able to recognize the different lesions and then be able to manipulate the app. But I think those challenges have been overcome. Or sometimes we have people who live far away and they have to pay transportation fees to come, and this is a handicap. So access to healthcare has been, even though you have these tools, still has been some challenges. So my title for this talk was Global Efforts and Grassroots Efforts. And I was kind of trying to see, okay, so what's the similarities and differences? And the similarities is that we are aiming for the same thing, that we'd like to have improved health for the patients and the people. So that is the same, but the approach we are taking are different, or we just work in the different levels. And that sometimes it's difficult to fill in the gaps between the two. And I would say that as you can see from some of my projects introduced, I consider myself to be more from the grassroots levels, but I had the privilege to work also at the global efforts. And that I'm happy that some of the things that we put in the SkinNTD framework is actually from this experience and the knowledge I obtained from the field that I and we were able to put into this document. And this is for the broader, so I believe that many of you are dermatologists or the trainees. And so, and thinking, oh, SkinNTDs, this is not something that is not part of your jobs. We were just interested to know about it. But I would like to mention here that no SkinNTDs is special. We see scabies or other, if you're living in the endemic areas, we see them in our daily practice. And also if you are from the high-income countries, with globalization, we do see and may see SkinNTD sometimes somewhere. And I'm from Japan, and we have originally, and then we have eliminated leprosy, but we still experience a few cases per year. Mostly they are imported cases, but sometimes we do have domestic cases. And then, so the question is, the cases are not zero, then we need to know about the disease. And also we may just not know that these diseases exist in your community or in your country, because if you don't know if it exists there, you will not suspect. So this can be the case. Reporting is very important to understand the correct epidemiology of SkinNTDs and skin diseases. And so dermatologists really have a key role in this. And how can our daily work contribute in the control of SkinNTDs? Nothing is special. What we do in daily work may also support in disease control for SkinNTDs. For instance, with our COVID pandemic, there has been much teledermatology going, or many of the SkinNTDs share wound, and wound management can be one also cross-cutting area. It is a matter of interest and thinking how we can apply and contribute to the public health initiatives. And we can all take part in achieving skin health for all, which is also the ultimate aim outlined in the SkinNTD framework. Today, I did not go much into details about each disease, but you can go to these documents as listed. The top ones are from WHO. If you want to know more about the diseases, this is more clinical. Also, you can go to the Open WHO ORG for online courses for each disease. And these are some articles that about the SkinNTD integration. So now I will hand over to Yona, who will be talking about more about the grassroots efforts of Tanzania and his good work. So over to you.
Okay. Thank you. Thank you, Dr. Rie. Hi, everyone. As I've been introduced by Dr. Rie, thank you, Aswantai, and the GLODEMS committee for this incredible invitation on how can we fighting against NTDs. I will go directly simply because Dr. Leah has introduced some tips on what we have been discussed. My name is Yohana Diangaz, public health advocate and a medical laboratory scientist from Tanzania, and I have been a previous social media manager of Africa of the International Society of Negligible Tropical Disease. I'll pass through on the impact on the social media on fighting against NTDs. And my slide will include some little contents that will show how the social media can exert a positive impact on fighting against NTDs. Yeah, literally, you have to know a little bit what is NTDs means. The negligible tropical disease, a group of parasites and bacterial infection disease that affect more than 1.7 billion people, including more than 1 billion children and women. Over 40% of the global NTDs burdens is concentrated in Africa, according to the WHO. As I have literally shown some of the NTDs or negligible tropical disease with their consecutive agent. So I may go on SkinNTDS. SkinNTDs prevail in setting characterized by fragile health system, and they can lead to the psychological problems, stigmatization, exclusion, and distress, which will lead to the mental health. Why I got interested in the SkinNTDs? They are neglected because they are almost absent from the global health agenda. Even today, when they focus on the universal health covering, the entities have very limited resources and almost ignored by the global funding agent. NTDs are a diverse group of 20 conditions that are mainly preventable in tropical areas, where they are most affected in provisioned communities and disproportionately affect women and the children. How most I worked at the NTDs activities. I mostly reporting various NTDs events from community to the social media, and I have been conducting the public health awareness to various school children, as a photo will be shown on the next slide. Also has been participating in various research, like one of the nation survey, that is Tanzania demographic survey and the malaria indicator survey of 2021 and 2022. Also has been conducting public health surveillance, investigation, and intervention to various NTDs project. So why did I choose the social media, the means of fighting NTDs? We have seen the social medias such as Facebook, Twitter, and Instagram has large number of peoples. Facebook had 2.93 billion monthly active users in July 2022, pressing to be one of the first in our ranking of the world's most active social media platform, acting according to data reported statistics. When looking at its audience worldwide, data show that the Twitter has 396.5 million users, although it may fall behind the platform like Facebook and Instagram that has used in the billions. Twitter still has a loyal audience for that log in a regular basis. And those are just logs for those social media that has been used in fighting against NTDs. We have Instagram, YouTube, Facebook, WhatsApp, LinkedIn, Snapchat, Twitter, and etc. So how the social media has been contributing in fighting against NTDs. The impact of social media on the public health can't be underestimated because the social media is the modern day equivalent on the game or the telephone. One person tells the other person something The second person pass it on the third, and so on and so forth. This voice can influence people to engage and taking care of their health, and that is other due to the power of leaking pot and the power of the numbers. So when did I started in social media network? I started on July 2020, soon after the meeting of conference with the elected director of NTDs, Dr. Mwere Maricela Nturi of WHO at Kilimanjaro Heart Halls in Dar es Salaam, when I was in the last year of my undergraduate start at Muhimbili University of Health and Allied Science. So we have been created different groups on how can we socialize with the other youth from other countries. We have more than 15 WhatsApp groups that have been each more than 20 youth and elders who is involved in public health advocacy and NTDs research mentors. This group is involved the people from various parts of the world, but mostly from the Western Africa, Nigeria, Eastern Africa, Southern Africa, and the Central Africa. Some movements and idea initiatives started at the social media and being finalized at the community field. These are the example of the WhatsApp group that has been mostly been used for NTDs public health awareness. We have created more than WhatsApp and the network to increase awareness and the public health education about NTDs. So WhatsApp group has simplified on the public health awareness, self-evaluation in our goals, flow of information about NTDs, and the youth advocate engagement. As you see, these groups. Also, this group have made easy engagement of youth from various countries to come together for discussing different global health issues. And we mostly dealing with the NTDs, where we have members of group from different countries like Western Africa, Eastern, Central, and Southern Africa, and even some few members from the European nation. So what are the succession on our discussion on different social media? Extreme succession through the positive use of social media has been easy to get engaged with some people who were responsible with the NTDs in fighting champion, like the rated director of WHO on NTDs, Dr. Mwere Nturi, who has already passed away. That has been tried to mentor the youth on how to engage in various activities on NTDs. As you can see, the chatting with her when she was alive. Also, social media has made us working with some platform that fighting against NTDs, like the International Society of Negligible Tropical Disease, where I worked there just for 3 months as the social media manager of Africa on reporting various events, the task forces, and the Sense About Science, Minagul, the world champion list. If you just follow on the website of Minagul, you will find the champion list. There's some youth from Tanzania, including me, we are inside of that list. Who WHO NTD expert and other NTD world experts, the social media has made easy engaged different NTDs experts from WHO and other agents, which has tried to increase the exchange of idea and techniques of fighting NTDs in raw economic countries. As you see, some of the screenshot is various experts on fighting NTDs. We have there Gabi Stems, the director of community communication on WHO. We have the WASH for Impact Development, that is experts from Nigeria. Also, through WhatsApp groups, as a group of the youth, we have been discussing on how to analyze and write papers for publication. Our discussion on manuscript lay on NTDs, since its impact range to almost to affect the 1.7 peoples who are at risk of getting, according to WHO. As you send the screenshot that show when we were been discussing how can we publish the papers, where the group of youth from different countries, as you can see on the screenshot. So why do we insist youth to engage in fighting against the NTDs? The youth are vulnerable resources for organization and for app involved in community health and the school education. By encouraging and allowing opportunities for the adult youth, collaboration, communities and organizations can help youth learn valuable skills and prepare them for become the public health advocate engaging adults. Yeah, you see the image, that was me when I was doing my undergraduate research at Kigogo Primary School in Dar es Salaam. I was dealing with the prevalence of schistosomiasis and people in students, among the students on the primary schools. Also, according to Jose Liza said, youth is hope for our future. Thus, we should allow them to create changes and challenge them to be the real hope of our future. As we allow the youth to engage in global health and the fighting against NTDs, and the positive would be shown. Also, youth is the future of the society. The young generation simply need to renew, refresh, and maintain the current status of the society. When the youth contribute his ideas and energy to resolve social issues, they become capable as the leaders and also make difference in the lives of the others. Nothing can equal the splendor of the youth. To be young, that is itself, it possesses the treasures of infinite worth to greater than any person on the power. It is the responsibility of the older generation to provide them with the right resources, guidance, and a good environment so that they become a strong changes agent in the community. The photo taken there was among of the photo which I took when we are dealing with the Tanzania HIV impact survey of 2022 and 2023, the FEAR project. A straight away forward, my key submission to the global public investment meeting alongside, to be a solution, it must be intentional to impact everyone, everywhere, reaching the very last person and the community. Integration, solidarity for sustainability, and equity in healthy investment. Social media is making interaction between the users and the service providers possible by providing relative simple, easy to access social media events using the mobile phone and by the platform for sharing the feedback. Patron wonders then that may help providers in the world social media such as Twitter, Facebook, YouTube, and the different blogs. So SkinNTDS, according to WHO, advocates an integrated approach to the control negligible tropical disease and fighting the NTDs and enhanced area. We have to detect, term treatment, morbidity management, and the disability prevention. Social media and the public health issue have become extremely linked as the peoples around the world use the social media to get inside from official social media platform and to learn what their families and their friends say about the current health status. Reputable and respected health publication institute and individual can take the advantage of social media sites and use them for the public social media campaign. Health authorities are the only ones who can using the social media platform to amplify public health messages. Therefore, the better understanding of the effect of the social media intervention on a public health protection against negligible tropical disease, while taking public health awareness and the behavioral change into account as the mediators should be helpful when developing the youth promotion strategies plans. And that's just my end of my presentation about how the social media can help to fight against negligible tropical disease.
Well, thank you, Yona, for your great presentation and the work. I'm now sharing the questions for the Google form. Aswan, can you put the Google link to the chat, please?
Yep, the link is in the chat box now.
Mm-hmm. So I think, but do you want to, we can go through a Google form, but also we have some questions in the chat, so that we can also, I will first introduce about the Google form, and then while people can take a look, we also can go through some of the questions in the chat. I think that's kind of a good strategy with the time we have. And so we wanted to have this session more interactive with audience, and also to hear your voices, and also so we can see how we are mostly from the grassroots level, working for the patient, working for the community. And so the idea was we can perhaps put together something, and we have created this Google form link, which you can see in that chat. You have until end of December 31st, to put your answers and to be reflected in this report that we plan to put together. And this will be shared to some of the policymakers. So that's the idea. So please it will take 10 to 15 minutes, I believe, and your contribution is highly appreciated. And so you can go and look at the form, and we will go over some of the questions. Depending on the time, we will see your feedbacks. But firstly, do you want to go to some of the questions in the chat?
Yeah, sure. I think while people answer the Google form, we can ask some questions. I personally have some, but the first one we have is by Dr. Hamedi. He congratulates you two for the nice presentation, and he would like to ask Dr. Yotsu the next step on combating scabies and other skin manifestations like fungal infections, in particular to the sub-Saharan countries from the WHO perspective.
Mm-hmm. Yeah, so thank you for the question. And yes, as I replied a little bit in the chat, but for the scabies, it's entered the WHO SkinNTDS in 2017. And then we formed this informal guideline committee to develop some way forward, but which has been hampered by the COVID-19. And also scabies is very endemic, I mean, high prevalence, and also the fungal there are to idea is that we kind of combine together like the mycetoma and other deep fungal diseases as also the superficial fungal disease, because the diagnosis and the treatment, they're shared. So discussions are going on, but not really something that we have some answers to your question. So, but it's ongoing discussion.
Yeah, it's hard to discuss it. The next we have from Anthony Charles. I think it's directed to Yona. So he says, combating NTD in social media is not enough. We should go to the grassroots and publicize this issue. Remote areas, especially here in Tanzania, are not aware of NTDs, and they do not engage much on social media. So he believes we should go and educate them. So what are your thoughts on that, Yona? What do you think?
Yeah, thank you, Royce, for chance of just leading such question. And we trust that anything started by ideas, the participants has shown the way forward on how can we include on the fighting NTDs. Although a lot of numbers, they are not engaging in fighting NTDs or in public health issues, but we can take that as an opinion, so as we can include in our goals on how can we just increase more education on how to fighting NTDs through the social media and the community also.
Yeah, and Dr. Hamedi also commented that he supports the idea and we should create a way forward, but we need to do research and identify the gaps on how we should use knowledge, awareness, and practice towards the use of social media in combating SkinNTD. So I guess we all agree on that. I have a question to Dr. Yotsu. So I've been doing some research about teledermatology, especially in low resource settings. And I've come to the conclusion that many people there use WhatsApp. I know it's legally, it's not the best thing, but people share like photos of the patients, and it's really hard to implement like a system, a website, or an app that they will substitute the WhatsApp use, right? So what do you think about that? Like, how is in Côte d'Ivoire that you have some, what are your experiences? Like, do they only use the app that you developed, or are they still using like WhatsApp and sharing, you know, patients' pictures?
They still use WhatsApp for immediate communication, but also WhatsApp or Facebook or these open social media is really not good to for patients' information security. And so, for instance, if you would like to run a research to get a research fund, you cannot really, I don't think, advocate you're going to use WhatsApp. That's one. Yeah. Secondly, so initially it was difficult to kind of people to understand the benefits of a very closed system which have been developing, but now they understand that the benefits of the system, that the patient data gets organized and they can patients for treatment adherence, and they get also the lab exam result. Basically, you can convince the people to use the system. It takes time in patients, but the WhatsApp or it's good for, like I said, immediate communication. So it can be used in combination, but really for a real system to be in place, it cannot be continuously using the social media. That's for patient management. So that's kind of my position in this.
Yeah. And have you tried to apply your app in other countries?
Yeah, so I'm been working also together with some Ghanaian researchers, and also actually we are discussing a project together in Tanzania with the dermatologist from MOSI. So let's see how that goes, and also in the Philippines. So depending on the countries, the implementation kind of steps are different. So yeah, that's also kind of needs time to kind of set up the system. But we're trying.
No, it's nice. And I have one last question about the app. Does this, because in low resource settings, sometimes we don't have like a good internet, fast enough to support the app. So does your app that you developed with a Japanese company, does it require like a lot of internet, or is it like easy to use? You can, download in any phone?
So we have, the data entry can be done offline without internet connection. But of course, if you want to do the teledermatology, you need to upload the images and communicate with a remote specialist. So for that, you need the internet connection. And we've been facing some issues with where there are so many photos taken by one practitioner or nurses. Then it takes a little time to upload the photos, but that's also we are making some adjustments, and so it's ongoing process. But there is the issue, but also the internet connection everywhere is getting better. So the idea is that we should not wait for the internet connection to get better in that place. We should start working on these things also simultaneously when the internet connection is improving. So yeah, it is still a challenge.
I think we have also 2 questions from the Q&A session. So Wang asks about genital entities, if there are any, or what are your thoughts about it?
Oh, the genital entities?
Yeah.
Well, that's really a good question, and I will say that is actually really even more neglected than the diseases on the SkinNTDS, because really people hide. And also even when I go to the clinics of these countries, many of these genital diseases, for like even if it's female, then it's like managed by the midwives, and then really the dermatologists don't also see. So I also am not sure the magnitude of the issues, but I know that this is a huge issue, and thank you for bringing that up. And I think that's some area that we need to explore more and need research on how the disease burden is.
Yeah.
So thank you for that question.
Yeah. And the last question we have is from 190 Suya. Oh my God, I hope I said correctly. So she congratulates you on the presentation, and she says, she or he, I don't know, looking on the grassroots, do we have independent initiatives for each entity, and how can we incorporate it at hospital, at community level, especially in low resource settings?
I did not get the first part.
Yes, I think she's asking if we have like independent initiatives for each entity, or just like a general one, if you know any, like I think on scabies or initiatives on each of them.
It depends really on the disease. So for instance, like leprosy, it's really ancient. Well, the disease has been for a long time affecting the people, and so there are many NGOs, many expert groups working on leprosy as like compared to other, for instance, like there's a lot of work going for mycetoma, but most of the work is in Sudan because there's the mycetoma research center. And we know a lot about mycetoma in Sudan, but not outside the country. And so that's still a big gap about the disease. And so it really depends on which disease you're focusing on and also where you are. And really, we still need these initiatives. And if you're interested in supporting, and if yes, your initiatives will be also welcome. So, so I don't think we do have the time to go through the Google form, but yes, it's for you to answer, and whatever the you can also put the question if you have any more, but if you need to put your email address for us to answer to you. So if you have any questions, you need to put your email address. But if you don't put your information, it's okay, but please do. That's not necessary, but we will really welcome your responses to the form. Yeah. So,
and
yes.
also we have we'll be uploading the presentation on our YouTube channel, so also people can post comments there and ask questions, and we can send you the questions so that you can answer. So as we are 2 minutes of finishing the lecture, I'll be closing. If Dr. Yotsu, do you have any more comments, or can I close the session?
Okay. Yes. I'm just skip the slides and for the closure.
So thank you all for listening and participating. I know that the session was right on at the time of the final game. So we really appreciate that you took the time to participate in our webinar. So as I said, we'll be sharing the webinar in our YouTube channel, GlowDerm's YouTube channel. It's pretty easy to access. And can you go to the next slide, please, Dr. Yotsu?
Oh,
And we invite you all to participate in our next webinar. It will be hosted by Dr. Esther Freeman, one of our founders, one of GlowDerm's founders. It will be on January the 2016 at 16 GMT time. It will be about how to do a peer review, especially focusing on dermatology trainees. So it will be really interesting, especially for those who have a research interest. And I think that's it. We thank you, Dr. Yotsu, Yona. We thank you all for your time and your patience. And we were really excited to receive you here. And the 2 lectures were amazing. So thank you for your time, your participation. And if you all want to contribute more with GlowDerm, we are really open for everything, every suggestion that you have. So I think that's it. Thank you very much, and bye-bye.
Thank you.
Bye, Yaswan. Bye. Thank you. Bye.
Thank you.